Hello, welcome to Within the Frame, where we delve deeper into the top stories taking place not only in South Korea but across the globe. I'm Kim Bo-kyoung. It seems like South Korea was slowly but certainly getting to the endemic phase of COVID-19. But what is happening worldwide is posing possible risks to this. China's reopening after nearly 3 years of isolation, even amid a massive surge in the number of cases, and a new variant gripping the U.S. and further leading to its prevalence globally. Adding on to the COVID-19 concerns, this year's cold winter is seeing more people suffer from influenza than before. Should South Korea be concerned about travelers from China? How strong is the impact of the new variant XBB.1.5 expected to be? And what are the differences between COVID-19 and the flu? For an in-depth analysis on whether or how South Korea should brace for this COVID-19 wave taking place worldwide, and for more information for our viewers on influenza, we have Dr. Kim Seung-taek, virologist from Institute Pasteur Korea, in the studio with us. Hello, doctor. Welcome to the show.
Good evening.
And we also have Sanjaya Sananeka, professor at Australian National University Medical School, on the line through Skype from Canberra. Professor, thank you for being on the show.
Good evening. Thank you.
All right, first question to Dr. Kim. Now, according to the KCDA, since the travel restrictions were strengthened on January 2nd, 1 in 5 short-term Chinese travelers were tested positive upon arriving at Incheon. Now, that's even though they submitted the negative test results before boarding on the plane. I mean, why is this?
Well, first of all, I have to just say there are some sensitivity issues. The sensitivity of the diagnosing this COVID-19. Those sensitivity may be affected by the several factors, such as like a procedure, maybe some little bit different procedures in the Korea and in China, and also different reagents or like a different equipment that actually the people use for the diagnosis. So those kind of some different the differences in the sensitivity issues might just cause this problem. And also there is this kind of intrinsically just some virology and virus problem, because for example, like if I just exposed to the virus today and then I just diagnose, if I test it for COVID-19, I would probably be just tested as negative. Although maybe it's a couple of days later, I would be maybe tested positive. So, for example, there is some kind of some incubation period before just the virus can be a person who were infected by the SARS-CoV-2 or tested positive after a certain period of time. So that might actually collectively they might just affect some different just outcome in the just before boarding and then after boarding.
Right, so incubation period and also the differences in testing ways.
Sure.
Right, Dr. Kim, then in that case, could we say requiring pre-arrival negative test results, before boarding on the plane, is that necessary and is that effective?
I think still it is just better to have just the people being just tested rather than just no test at all, because such testing somehow may just play a role to just pre-screen some COVID-19 positive patients before boarding, before just getting on board the plane.
Right. Now, Professor Sananeka, Australia, I believe, has also required travelers from China to submit negative test results before boarding the plane starting January 5th. Are there any additional arrangements that have been put in place to prevent the spread of the virus?
Yes, that's right. From January 5th, that has become the requirement when coming from China to have a negative test close before your travel. It is interesting in the sense that generally throughout this pandemic in Australia, the government has taken the medical advice, but certainly in the newspapers here, it's been reported that the Department of Health didn't necessarily recommend having screening of people from China, but the politicians decided to go with it. And it does show that it is still somewhat of a controversial issue, and while a lot of countries in the world are doing it, not everyone is. In terms of what we are doing beyond getting people to have a test within 48 hours of boarding a plane from China to Australia. There may also be testing of wastewater on the planes. And as Dr. Kim was saying, it is good to know whether people have a virus. And of course, if it's positive, our genomic labs can work out what kind of subvariant it is and if it's something new or unexpected.
Right, interesting. Now, Professor Sandanayake, one more question. What is the most concerning aspect of the surge of COVID-19 cases in China? Why is it so dangerous?
Well, I think it's very dangerous for China because they haven't had a large amount of natural immunity from infection, as we've seen in lots of other parts of the world, such as in Korea and here in Australia. So that means people are more susceptible to serious illness. And there's also concern that particularly those vulnerable groups, such as the older people in China, a smaller proportion of them compared to other parts of the world may have been vaccinated. So there are concerns about them ending up in hospital. From our point of view, the reason for surveillance is we're worried because China we haven't seen a huge amount of data from China about this outbreak, whether there are different subvariants out there that may be completely different to what we know about, that may be more evasive to our immune system and more dangerous. And that has been the concern. And of course, the ongoing concern is if you have lots and lots of cases in the world or in China, that gives opportunities for the virus to mutate further.
Right. Now, Dr. Kim, moving on from China to the United States, Washington is very much concerned about the rapid growth of the new Omicron sublineage XBB.1.5, which is known to be the most transmissible form of Omicron. Now, how concerning is this?
Well, the variants actually just come out repeatedly and again. And one of the selective pressure as of now is our immune status. Most of the people now are somehow immunity, whether it is by the natural infection or by vaccination. So some level of immunity is actually plays a role of a very selective pressure for evolving the virus evolution. So now the virus somehow also tries to find a way to evade our immune responses. So one of the immune responses that actually is an antibody that our body is actually generated. So one of the reasons that people are concerned about this particular variant is this variant seems to evade some, especially some our immune response, for example, like in this case, a neutralizing antibody. But then other things are actually, whenever the variant is coming out, the people are concerned about how transmissible it is and then how severe disease these viruses causes. But in terms of severity, we do not know for sure at this moment. And then and also the assessment of severity is now very difficult because the people are now no longer just naive against this virus. Somehow the people, as I said to you, the people are just immune to this virus. Somehow, maybe levels are different, but somehow immune. So then maybe assessing the severity is very difficult. Also, the transmissibility, maybe not. It's not really just a simple the issue to answer. But somehow the fact that now XBB.1.5 is now is prevailing is that the virus is now just gains some superiority. I mean, just prevailing. The viruses are somehow also they compete with each other. So one of the reasons that the particular variant emerges is that this variant has some more advantage over the other variants. We say this virus more fit than the other variants as of now.
Right. So the severity issue we do not know yet, but you talked about how the XBB.1.5 is more able to slip past our immune defenses. I mean, it is already been detected in South Korea, and a lot of people are concerned about how much of an impact it could have on our nation's healthcare system. Would vaccinations in South Korea work effectively against the virus?
Well, first of all, we do not know the data available yet because this is kind of a very the new variant. So we need more data to assess and then answer how seriously we actually deal with this virus. But based on our the experience in the past about the other previous variants and others, that I do not really I do not really concerned about the variants just too much because if the purpose of our vaccination is to just prevent the infection, then maybe we actually losing just the power on this specific just variant and other variants because the neutralizing antibody, which is the main role of this neutralizing antibody, is prevent the infection. But now we have shifted. Just the goal of our vaccination is not the preventing infection, but the preventing severe diseases and the hospitalization and death. But in terms of that, our vaccination, I mean, whether it is by the vaccine, by the original just the vaccine or just a bivalent vaccine, our vaccines that we have used so far is pretty successful, just prevent severe diseases and then death and hospitalization.
Right. It's good to hear that it could be successful, preventing the serious severity issue.
Sure.
But still, Professor Sandanayaka, variants seem to endlessly emerge, right? Exhausting so many people, including me. Is this unavoidable, and will the world be able to move on from the pandemic to endemic stage ever?
Yes, you make a very good point. Right now, there are about, I believe, around 500 different subvariants running around to the point where we use this term variant soup. It's like a soup with so many ingredients of Omicron subvariants. But the important thing to remember is that really from the end of 2021 till now, January 2023, all these subvariants and sub-subvariants, they're all still Omicron. And the hybrid immunity that we have in places like Australia and places like Korea, due to a combination of high vaccination rates and immunity through natural infection, will, as Dr. Kim said, be very effective, has been very effective, and most likely will continue to be very effective at preventing us going to hospital with other variants of Omicron, even if we still get infected again. The World Health Organization, regarding about when we're becoming endemic, the Director General spoke in September about nearing the end of the pandemic. We're nearing the end of the marathon, but we have to keep sprinting to get there. We are in a better position than we've ever been overall due to vaccines and natural immunity and the fact that Omicron has prevailed over this last year or so, but we're still not endemic. We would not tolerate this amount of COVID in a 12-month period, but we're slowly heading towards it. And unless COVID throws us another curveball, which it has done many times during the pandemic, and creates some terribly new variant that our immune systems can't respond to, we will get there. But as to when we will get there and what that will look like, it's hard to know if 2023 will be the year or not.
All right. So though it's going to be a hard process, we will eventually get there. We'll have to have our fingers crossed. But Dr. Kim, now South Korean health authorities had announced last month the criteria for easing the indoor mask mandate. But amid such concerns, over Chinese travelers and the new variant from the United States, when can we have our masks off? And is that even possible?
Well, I think we can discuss this mask mandate anytime, because the variants will come again and again, and then at least just for a while in the future. And also the discussing itself, we can actually discuss anytime. I mean, some foreign countries already just experience this lifting of the mask mandate. But I think generally the ultimate goal is that this mask mandate is probably just actually it's shifting from the government's mandate to the some individual personal just responsibility. And then the point is how we can actually protect the vulnerable people without such as the government just regulation. The vulnerable people, I mean some very elderly people, and then the people with the underlying medical condition and the immunocompromised patient. And this is now we are experiencing the still just a seventh wave of COVID-19. So, and also we are in the middle of just winter season. So most of activities are actually occur at the indoor settings, which is very good just a situation for the very easy just a transmission of the viruses. So so we have to actually just consider all those aspects, and then the discussing itself we can discuss anytime anyway.
Right. Well, but unfortunately, COVID-19 is not the only concern right now. South Korea has not seen a flu outbreak since 2020, which is for 2 years. But according to KCDA, the overall weekly influenza-like illness rate was from December 25th to 31st was 60 per million, which is 60 people out of 1,000, and that is 12 times higher than usual. Why the sudden hike in the number of, flu patients, and when will it peak?
Well, I don't know when we will peak, but this situation, we are actually experiencing this, but also other countries experience the very similar phenomenon, including just the United States. And then one of the reasons is that for the last two winters, the flu seasons, we actually keep a very good, very strict social distancing guidelines, and also just the mask mandate, things like that. So this kind of practice actually basically is very good for preventing some respiratory infectious diseases. So that's why we could just prevent the flu for the last two winter season. But now we are kind of just loose in terms of social distancing guidelines and the mask mandate, especially outdoors. So this will somehow just facilitate the easy transmission of these influenza viruses. But another reason is that for 2 years, somehow the maybe low vaccination rate, especially for flu vaccination, and also maybe some very young children, they are probably very immunologically very naive to the influenza virus, which is they did not experience maybe some vaccination or sometimes just the natural infection. So basically, our immunity level is very low. So which means that the population level, we are just vulnerable to the influenza virus infection this winter, unless we got some maybe flu vaccination.
Right. Professor Sananayake, in that case, what are flu's main symptoms that can differentiate it from COVID-19?
Oh, I was hoping you could tell me, because it's very hard to tell the difference. In fact, there's a term we use called ILI, influenza-like illnesses, because there are lots of respiratory viral infections that can act just like flu in the way that people are sick. I was looking at the ZOE study from the UK, which has been looking at people's symptoms with COVID and currently with Omicron. And what we used to see with high levels of, or high proportions of people having problems with their sense of smell and taste, that's not such an issue with Omicron anymore. It's basically things like a sore throat, a cough, a runny nose, or a blocked nose. And you can get all those, and a fever, of course, and all those things you can get with influenza. So the short answer is, if you're feeling like that right now in Korea, where there's potentially co-infection, make sure you're tested for both, because you could be potentially treated for both as well.
Right. But Professor, as far as I know, there hasn't been a case in South Korea where one person had been infected with both of the viruses, COVID-19 and the flu. But is it even possible to get infected with both of the viruses?
Yes, look, the Twindemic, they're calling it. And as Dr. Kim had mentioned earlier as well, we haven't seen a huge amount of it because flu disappeared for much of 2020 and 2021. We basically had nothing here in Australia last year. It was absolutely remarkable. But we have seen cases in Australia, and there's been published data on it. The CDC in the US looked at hospitalized children with influenza, and they found about 6% of them also had COVID, and those children were more likely to need respiratory support. And of the children that died from influenza, 1 in 6 of them also had COVID, and most hadn't been fully vaccinated, and only 1 had got antiviral treatment, emphasizing the importance of getting your flu vaccine and getting your antivirals for flu if you have it. And if you meet the criteria for it. And in adults as well, there's been data from the UK and from the US showing that co-infection is possible. And the UK data also showed worse outcomes if you've got both. The US data from the Mayo group didn't show worse outcomes apart from worse symptoms. But yes, it can happen. And yes, you tend to do worse if you have both.
Well, Professor, I mean, just by thinking of having both of the viruses, it's too scary. But Dr. Kim, there are no certain guidelines for those patients with both of the viruses, are there? And how should they be treated?
Well, we have actually effective treatment options for both the influenza and then the SARS-CoV-2. But those drugs are actually antiviral drugs, which means that we have to use those drugs as soon as possible. For example, in the case of Tamiflu, for just flu infection, we have to use preferably within 48 hours after the symptom onset. And for the SARS-CoV-19, we have to, for example, like the Paxlovid, we have to use within 3 to 5 days of symptom onset. So it's a very short window of just a treatment. But the problem is whether we can actually just combine just these two drugs. Actually, we do not have enough just clinical data to supporting this drug just combination. But at least from the most guidelines that we do not have no reason to just combine these drugs. But at least I want to just make sure that there's not enough just clinical data. But we can use theoretically. And then some people may be concerned, maybe thinking about some sequential treatment. But because of maybe Tamiflu for 5 days treatment and the Paxlovid 5-day treatment, so sequential treatment may not be really just a viable option. So sometimes maybe we have to think about just the drug combination. I mean, just at the same time.
Then, Dr. Kim, I know that there's no 100% prevention possible, but is there any preventive measure that we can adhere to prevent ourselves from both of the viruses?
Well, number one weapon that we can actually use the vaccination. We have very effective vaccine against the flu and then COVID-19 as well. So that's the number one choice. And the second one is wearing mask is really proven the method to just prevent all just respiratory just infectious disease, and also washing hands after your just outdoor activity, and then also some avoiding some crowded places like some public transportation and then some closed area.
All right. Unfortunately, this is all the time we have for today's edition, but thank you, Dr. Kim, for your insights. And of course, thank you, Professor Sananayaka, for being on the show. We appreciate it very much.
Thank you.
Now, that's all for Within the Frame tonight. Have a great rest of the evening, and please do stay safe. We will be back tomorrow with more in-depth stories on the issues happening in South Korea and, of course, around the globe. Thank you for watching, and goodbye.